So the key finding of the paper for me was really how the authors were able to synthesize a lot of information together and boil it down or distill it down into the main themes that they did. I found this particularly useful because there's a lot of complex interactions and relationships. A lot of the paper content resonated with me as a guest lecturer in the prostate cancer support group. I found myself nodding along with the information that was provided. I think mostly that they highlighted men's need for information on general wellness, on illness demotion, and as well as key findings around how people in the health promotion field could use some of this information to help plan their programs. In my experience of presenting with the prostate cancer support groups, I find that the nutrition information needs of men are quite vast, actually. They have probably two main areas. One would be general health, or maybe chronic disease management is a strong area of interest. The other area I find that is more suitable to my knowledge base is looking to information on diet that might help lower recurrence risk or delay the progression of prostate cancer. So for men with prostate cancer, I find that nutrition and exercise are probably some of the most underutilized tools in their recovery. And nutrition can definitely help with weight management, that is an issue with men with prostate cancer, and also help with the transition that we find happens with long-term hormone therapy. So men often will complain of weight gain that occurs, loss of muscle mass, and also loss of bone mass. And nutrition, having a diet adequate in calcium, have a diet balanced in calories, can help with weight management and these issues. And exercise, of course, is very important, has a number of benefits for men with prostate cancer, and I find that it's not used as often enough, and that can help with increasing muscle mass, retaining bone mass, general well-being, and just combating many of the side effects of the long-term hormone therapy and cancer treatments that men undergo. From my experience in presenting at the prostate support groups, I find that women do attend, often the partners or spouses of men. Most often what I find is women are already converted to nutrition and they're really looking for their partner to hear more information from an expert. And I think they've tried to convince their partner to eat healthier and to take a more active role in nutrition. And this is their chance to be an information gatherer, but also be a stronger influence in men's health. And I picture them going home talking about this and reinforcing the message that they hope that the whole family will eat healthier. An interesting thing I found about the paper was how they highlighted that men can have a powerful influence over other men's health behaviors, not only in modeling, but just also in discussing and sharing information. And I think that's important information for health professionals because we tend to think of behavior change as maybe a one-to-one type of arrangement in a research study or in clinical practice. And so I think we haven't fully utilized the types of benefits that can occur in a group setting. And I think that was an important thing for me to learn from the paper as well.